Southwark Crisis Services also provide a full range of out-of-hours cover. There's always a team member available to support people experiencing crisis or to take referrals from other professionals.
OK, what's the problem? OK, is she feeling suicidal?
Could you send her straight round to Majors?
My name's Michelle Clark. I'm psychiatric liaison nurse here at King's College Emergency Department. My job is primarily to see people who are coming into the emergency department with symptoms of mental illness or suspected deliberate self-harm.
It's Michelle's job to assess people's psychological state once their medical needs have been met.
We're looking at the mood, any signs that their mental health's deteriorating. Describe to me then your mood at the moment. If we think the person is quite unwell or the risk is too difficult to manage in the community, we'll go for an admission. And that's really where the Crest service comes in, because they then come and assess and see whether they're suitable to be taken by their own team as an alternative to the admission.
Across Southwark, you can be reassured that easily accessible specialist psychiatric care is available 24 hours a day, 7 days a week.
I cover St Thomas's A&E and King's College A&E. So wherever a person has been seen and they need a home treatment assessment, I'm called out.
Probably due to the late shift and they didn't hand over.
I think the nice thing about this post is that there is someone to go there, whereas in previous times, a person would have to wait until morning or come back in the morning, which can be very daunting for a person who's very distressed and very unwell. It just helps. Someone's got access to their records, being able to talk them through their treatment, finding out what the problem is. Sometimes it's as simple as having run out of medication.
Nyasha has a specialist range of resources available, including observation facilities within the clinical decision unit.
Sometimes it's very difficult to make an instant decision as to what a person's mental health needs is, or sometimes a person may be too tired to talk to you, so you can't get a really full picture as to what their mental health needs are. So it comes handy to just observe them maybe overnight or over a couple of days until you have a clearer picture.
All of the crisis services provided by South London and Maudsley NHS Foundation Trust share one goal: to work with people to promote their recovery.
If you're feeling unwell and you identify that sooner rather than later and contact services, that's the first step in recovery. And the quicker you contact services and the quicker you get support, you can avoid probably going into hospital, or certainly avoid it unless it's absolutely necessary.
I've recovered much more quickly, much more robustly, and without losing friends and without getting into rows with people and then getting frightened about the consequences. Just a so much pleasanter experience, as well as a better outcome.